Hello, everyone, and welcome to Fertility Diaries, where we navigate the emotional, physical, and often challenging battles of fertility together. I'm your host. My name is Nkechi, NK for short, and I'm grateful that you are here with us today. So, this is episode 9. In this first series, we're having a series of thoughts on understanding infertility and treatment options. Today, we'll be delving into the topic of PCOS, that's PCOS, its causes, its treatment, and options. I'm incredibly excited. I'm sure you already see that in my face, and I'm smiling from ear to ear. We have a renowned medical doctor with us in the person of Dr. Chukwudi Ufondu, renowned fertility coach and doctor who has dedicated his life to supporting couples on their journey to parenthood. So, as we go forward, you will hear from him and he will be, talking with us and advising us on the best way to handle PCOS. Whether you're just starting your journey or you've been on it for years, I hope this conversation brings you hope, understanding, and valuable information that you can use to find yourself in a better place. So let's begin. Like our culture here, we always set the tone for the day by reading a Bible passage. And our passage today is Philippians 4, verse 19. And it says, My God will supply all my needs according to his riches in glory in Christ Jesus. So just take a moment, reflect on that. All my needs. So there's nothing you're looking for that God cannot give to you. Is it children? Is it money? Is it health? Is it a job? Everything. Just focus on God, pray about it, work hard at it. Don't sit down and expect that manners are going to fall from heaven. So apply the verse, but you have to do your own part. All right. So welcome everyone. Welcome, welcome, welcome. So Dr. Chikudi, welcome, sir. Welcome to the show. We are so honored to have you here today. I am so excited. Before we start recording, I was telling you that I was just going through the list of people I know, doctors I could talk to, and your name popped up on my head, and I'm like, should I not? And I'm like, okay, yes, let me just go ahead. And I did, and you honored us by being here today. We are so grateful to have you here, sir, and so honored. So thank you so much, sir, for
Yeah,
coming.
thank you
Thank
so
you.
much for the privilege to talk to your community. I want to be sure you can hear me clearly. Can you hear me clearly? Am I audible? Okay,
Yes,
awesome. So it's a big
yes,
privilege
I can.
to talk to your
Very audible.
community,
Sir.
especially in regards to fertility management, in regards to women's health. Um, Women's health is a topic I'm really very passionate about, and it's a big privilege to be in your midst this afternoon. And I'm going to try my best to give you guys good feedback so that if you're currently having problems with polycystic ovarian syndrome, you can actually find help because knowledge is power. And just like the Bible verse you quoted, when God promises something, God always keeps his promises. So, by virtue of appearing this evening, is my firm belief that whatever we're going to discuss this evening is going to help someone to take the actions they need to take. So, thank you for the opportunity.
Thank you. Thank you very much, sir. So before we delve in, could you tell us a little about yourself and the amazing work you've been doing to support families on their journey to parenthood?
Yeah, can you hear me? Yeah, hello.
Yes, yes. So I was saying that you should tell us a bit about yourself and the amazing work you've been doing for years. I have been a follower for more than 5 years, I'm sure. You might not know me, but I do know you well. So please
Okay, well,
tell us a bit about
I
yourself.
trained as a biological scientist first before going to medical school. And after my medical school, when I came to America, I specialized in maternal and child health. Maternal and child health is a very important aspect of medical practice because everything all starts with maternal health. Without the women, we can't have babies, and of course, women play a critical role in the society. So, and I have my own personal experience in, the benefits of maternal health. So I felt my own way of giving back to the community is to start a platform where I can be helping women that are having infertility because knowledge it's actually the key to whatever you want to achieve in life. So I discovered that just basic knowledge of fertility, basic knowledge of reproductive health can change a lot of things in the family, especially among couples that are believing God for babies. Like the topic we are going to talk about today, polycystic ovarian syndrome. There are some women that might have it, and without the basic knowledge, they wouldn't know they have it, and they might be going about it the wrong way. So that's actually the reason why I kind of decided to use my gift and my talent to help everybody. So we've been around since 2015 and we've helped thousands of families, especially all those women that were abused, women that never knew they would one day become parents. Today, they all have their babies. Some are actually on contraceptives. So it's actually a big deal, watching someone that never had hopes and giving the person hopes. So that's the reason why I've been so committed to this community. Thank you.
Thank you so much, sir. Thank you. And it's in fact, it's a no-brainer that you are here because definitely this is your baby. At the end of the day, it's something I've heard from you over the years and something I just started talking about. So definitely you are an expert in this field. So thank you so much for sharing that with us. So let's get into today's topic. We'll be talking about PCOS. PCOS is something so many women struggle with, but there's still a lot of confusion around it. Could you help us understand what PCOS is, what causes it, how can it
Okay.
be,
Yeah,
treated
thank you.
or
That's a
managed?
very important question you asked, and I'm gonna use my teaching model. So if you've been following me, I normally use the teaching model to teach because if you make it simpler, it's gonna be way way easy for anybody to understand. So see, this is the
Yes.
internal female reproductive system. So the area we're gonna focus on today is the ovary. So this is one of the ovaries.
Okay.
So every woman will have two ovaries. Now, when you have polycystic ovarian
Yeah.
syndrome, can you still hear me?
Ovaries, yeah.
Okay. So when you have polycystic
Yes,
ovarian
I can. You're
syndrome,
very audible.
it's
Yes.
actually a complex hormonal disorder, and it can only happen among women of reproductive age. So women are divided into different phases, or you can say,
Oh,
reproductive cycle. So the period you can have your babies, without having problems. It's called the reproductive phase of a woman's life. Now, the period, obviously, you can no longer have babies, which is called menopause. It's when you will not be able to have babies because by then you no longer have eggs. So you come into this world with your eggs. Now, by the time you become of a woman and you start bleeding and all that, you start having your cycle. Every month you release one egg through the process of ovulation. So principally in polycystic ovarian syndrome, because
yes.
of some complexities
Yes.
in the way the body handles the hormones and a couple of other metabolic and reproductive abnormalities, women that have polycystic ovarian syndrome will have some struggle to
Yes.
ovulate. So the key problem in polycystic ovarian syndrome is the irregularity in the
Yeah.
menstrual cycle, which ordinarily every woman should have a regular cycle. When you release your egg, the availability of the sperm, then the woman will become pregnant. But in women that have polycystic ovarian syndrome, for some reasons, they will have hormonal imbalance. The major reason why they have this hormonal imbalance is because normally men are supposed to
Balances.
have a particular hormone higher than women, and women are supposed to have a particular hormone higher than men. So the hormones that men should have at a very high level is called the androgens.
Yeah.
An example of androgen is testosterone. So in women that have polycystic ovarian
Okay.
syndrome, instead of having normal level of
Yeah.
estrogen, progesterone, follicular stimulating hormone, all those female reproductive hormones that will make this system to work, so the woman will release her egg and become pregnant, they would rather have higher levels of
Okay.
androgens. So
Yeah.
androgens are male-dominated hormones. And when this happens, it will
Androgens.
disrupt the whole menstrual cycle. And when that happens, the woman will no longer be able to ovulate. And if you can't
Okay.
ovulate,
Yeah.
you can't become pregnant. Now, based on these hormonal changes,
Okay.
there is also a role for
Yeah.
a particular hormone that handles all the sugar in the body, which we call insulin. So women that have polycystic ovarian syndrome will also have insulin insensitivity. So the body is not able to handle insulin properly. So they will also develop a situation that will mimic diabetes. And that will further make the polycystic ovarian syndrome even more complicated. So the two important aspects of polycystic ovarian syndrome I want us to focus on
Oh,
this evening is the hormonal imbalance aspect and the side of the insulin insensitivity. Both of them will combine to make it difficult. So the hallmark of polycystic ovarian syndrome is infertility. So the woman is not able to ovulate, or if she's ovulating, is not regular, her cycle is irregular,
yeah.
and a couple of other symptoms I'm going to talk about, which overall will make her unable to become pregnant. So it's a major
Yeah.
cause of infertility in women in their reproductive phase of life. That's
Yeah.
what polycystic ovarian syndrome is all about.
All right. So,
Okay, so
how
before
do
we
we
even come to the
manage it or
management,
treat it?
medical practice follows stepwise approach. Now, unfortunately, out there are so many people that misdiagnose people,
Yes.
because infertility is common. So there are so many, people that claim to be doctors that are actually not doctors. They pry on your emotional, aspect of infertility. So before someone can be classified as someone with
Yeah.
polycystic ovarian syndrome, there are diagnostic criteria you have to meet. Number one, we have to take your history.
Yeah.
So we have to ask you a lot of questions, familiar history, and for some reasons, women that
Okay.
have polycystic ovarian syndrome can also have genetic predisposition. So genetic predisposition means if your mom or your sister had polycystic ovarian syndrome, possibility you're gonna have polycystic ovarian syndrome is also high. Now there are also some predisposing risk factors, like if you are on the overweight
Oh,
side or you have obesity, so that means your body weight it's not within the normal range, you are likely prone to develop polycystic ovarian syndrome. If you're
yeah.
diabetic, if you have stress, if you have other environmental factors, they can actually facilitate and predispose you to develop polycystic ovarian syndrome. Now, coming from the diagnostic criteria, before we diagnose someone with
Okay.
polycystic ovarian syndrome, we will go to the ovaries and take a cross-section look at the ovaries. So when you go to the ovaries of women that have polycystic ovarian syndrome, you will notice
Okay.
multiple cysts. So that's actually the origin of the poly. So you notice it's polycystic. So poly means multiple cysts inside the ovaries.
Mm.
Now, what happens is when you have those multiple cysts
Yeah.
inside
Okay.
the ovaries will no longer participate in their normal reproductive role. So they will no longer facilitate the production of the hormones. For example, estrogen, follicular
Yeah.
stimulating hormone, luteinizing hormone, progesterone. And when that happens, you will not ovulate. So the hallmark
Okay.
of everything polycystic, diagnostically, we have to get a history, we have to examine. So there are some presentation, there are some symptoms that women that have polycystic ovarian syndrome can present with. Visible things you can see with your own eyes. For example, women that have polycystic ovarian syndrome tend to have generalized
Yeah.
hair distribution as if they are men. So they have facial hairs, they have chest hairs, and hairs at their back. Some of them will develop male pattern or baldness. Of course, some of them might not bleed, or if they are bleeding is irregular. Majority of them will have weight problems. Majority of them will have voice presentation as if
Okay.
they are men. So it's pretty much the effect of that high level of androgens that will go and alter the normal way that God designed a woman to be before she can
Okay.
have a baby. So before we go to the management, we have to
Okay.
define the complexity. We have to define it by history. We have to define it by examination. Then we have to go for diagnostic test. Unfortunately, lately, you will just see someone that will go to a doctor and they will just tell you, oh, you have PCOS. Meanwhile, we have not diagnosed it correctly. So we have to diagnose it correctly. So we will not give people false hopes. So one of the things that normally happen in developing countries is the
Yeah.
possibility of
Yeah,
telling
exactly.
people what they have when they actually don't have it. So we have to define the diagnostic criteria first
Have
before we
it.
go to the
Yeah.
management.
Okay. So you've listed, possible outcomes, what people can see, the visible, signs like facial hairs, chest hair, and then high level of androgen in women, just having things that men have, which women shouldn't have. Those are like the physical attributes of it. And then that there should be right diagnostic. You shouldn't just, generalize that, oh, the person has PCOS. There has to be, take the history of the woman, then examine them, and then before you can actually now say. So after you've done that and you have now concluded that, okay, this lady or this woman has PCOS,
Okay,
how would you manage it or treat it? Is there any
of
hope of the
course. So
woman
in my
ever,
community,
getting
so the name of
pregnant?
my community is Snowspirations Global Health Solutions. We started this community in 2015. Sorry?
Okay, okay.
Okay,
So I
Snowspirations
wanted to repeat the
Global
name. I
Health
didn't hear that.
Solutions. That's the full meaning of SGHS. So we started this women's health group.
Okay,
It's a consulting virtual group. We
okay.
pretty much use all the social media handle because we figure that, since everybody is in social media, we can use that opportunity to reach people that probably might not have access to modern technologies when it comes to having families. So that's the platform we use to
Yeah.
reach out to a lot of women. So we discovered that a couple of women actually have problems, and this particular condition we are discussing today is one of the commoner problems that women have in
Okay.
our community. Now, guess what? No matter what you have as a challenge in starting your family, the best thing that can happen to you is to seek solutions early. So, the timing of diagnosing polycystic ovarian syndrome is important. Establish with
Yeah.
a fertility specialist, not just anybody out there that claims to be a fertility specialist, or you go and go up herbs, or you go and listen to your friends, or you go to places they will even make it worse. When you establish with a gynecologist is a special doctor for the women. The gynecologist will take the baseline investigations and confirm. Then afterwards, the gynecologist must refer you to a fertility specialist. So when you get to the fertility specialist, we have to confirm history, examination, and
Yeah.
investigation. Once we have a diagnosis, now this is where it gets so interesting. The biggest impact in managing polycystic ovarian syndrome is actually lifestyle modification. We are so in a hurry for quick fixes. So anything that happens, we always want to go, what can I take? That's how people end up abusing,
Yeah.
drugs, painkillers, antibiotics, fertility drugs. Like in Nigeria, it's very common for women to abuse clomid because once they are not able
Yeah.
to have babies, even some people will not even try the natural pathway. They just want to have what they want to have at the time they want to have it. So once we diagnose you have polycystic ovarian syndrome, the very first line of management is lifestyle modification. So remember I told you about insulin insensitivity, right? Now that insulin
Okay,
insensitivity
sure.
is because your body weight is not within the normal
Yes,
range.
yes.
So you're either you have obesity or you have overweight, which will alter the
Murmuring.
hormonal production in your body. Now the magic begins when you work on your body weight. So, assuming your body mass index, which is the criteria we normally use in knowing if a woman is overweight or not, if your body weight is high, if you are able to drop your body weight by 5%, 5% weight loss in someone that has polycystic ovarian syndrome, can improve the fertility by itself. So simply by watching what you eat, avoiding stress, exercising, avoiding alcohol, avoiding smoking, keeping yourself busy, sleeping. Sleep is very important. You can actually normalize those hormones that are out of range. So one arm of managing
Yeah.
polycystic ovarian syndrome is the lifestyle modification, which nobody can modify your lifestyle except you. So you're the person that will eat right, go to the gym, drink only water, avoid alcohol, avoid smoking, avoid
Yes.
stress, sleep. So if you can adopt this healthy lifestyle, you will inadvertently improve your fertility if you have polycystic ovarian syndrome. Now, besides the lifestyle modification, there are also provisions for fertility management. Remember that the problem we have in polycystic ovarian syndrome is lack of ovulation, right? If you understand
Okay.
the definition and the explanation again. So we will use,
Yes.
some people will
Yes.
require contraceptives to stabilize their
Yes.
cycle. So I'm sure you've come across some women that will be looking for babies, and when they go to the hospital, will prescribe oral contraceptives for them. So it's kind of ironic, right? So they will be wondering, I want to have a baby, and you're giving me something that will make me not to have a baby. So we are using those pills to stabilize your cycle first, so we can have a
Yes.
pattern. So oral contraceptives can be used to stabilize a
Mm.
woman's pattern of cycle. Then once we are sure of the exact phase, because what happens is in a woman's menstrual cycle, there are different phases. So we have ovulatory phase, we have follicular phase, we have the luteal phase. Then of course, if pregnancy happens, everything will go back to ground zero. So when we give you these oral contraceptive pills, it will stabilize your cycle. We can pinpoint when you're in your follicular phase, luteal phase, ovulatory phase. So it's gonna help with the lifestyle modification. Now we also give ovulation induction drugs. So remember that the big problem we have with polycystic ovarian syndrome is lack of ovulation. So women that have
Okay.
polycystic ovarian syndrome will also benefit from Clomid, clomiphene citrate, letrozole, so all those fertility drugs that people abuse. We can carefully prescribe and monitor them for some weeks and see how they can help you to, kind of, get back your normal cycle and actually
Okay.
ovulate. Now, remember when I told you about the insulin problem, right? Now, majority of women with polycystic ovarian syndrome will also be prescribed some drugs we use in treating diabetes. The popular one is metformin. So metformin is a drug we call oral hypoglycemics, which we normally give to women who have
Okay.
diabetes. But in this condition, in polycystic ovarian syndrome, we use the metformin to increase the sensitivity of insulin so that when you eat, the insulin will go to your body to distribute the sugar to various parts of the body, so you won't have high level of sugar in your blood. So these are the major criteria for treating polycystic ovarian syndrome. Now,
Mm.
some women might also require surgery. So that surgery is what we call ovarian drill. So we go to the ovaries, we perform some very technical, very highly effective drilling in the surgery to improve the possibility of the ovary to respond to releasing the eggs. So there are actually different levels of management of polycystic ovarian syndrome depending on the severity.
Yes.
So polycystic ovarian syndrome can also be classified into different levels of severity. So you can have mild polycystic ovarian syndrome. So women that have mild polycystic ovarian syndrome, I'm sure you've come across some women that have body hairs, they've been doing everything to lose weight, are not losing weight, but they will still go ahead and have babies. So if you have mild
Mm.
polycystic ovarian syndrome with all those hairs, you can still have all your babies without even knowing that you
Mm.
had those problems. But if you have moderate to severe polycystic ovarian syndrome, you will require treatment. Now, another important presentation of polycystic ovarian syndrome in women is the propensity of acne or pimple. So I know when you guys were growing up as young girls, you all had pimple and acne. But when you've outgrown that stage of having it, and suddenly you're having all over your body together with the body hairs and all those changes, then we can also give you anti-androgen treatment. Remember that the major problem in polycystic ovarian syndrome is the increase in the androgens, which will now
Oh,
suppress the function of the female hormones. So we can also prescribe
yes.
anti-androgens, which will help to suppress those androgens in women so that the level of the female hormones will come up and stabilize their body.
Thank you so much, Doc. That was really elaborate. Now I'm sure that I have learned a lot. I have a few friends who, have gone through PCOS. A few of them have, given birth, like you said, theirs was the mild one. And then the ones who couldn't, they are still in the process trying to get a solution to it. So definitely you've actually given us a lot of options that we can go through today, and that is really, really well appreciated. So for our listeners today, what's that one thing you wish more people
Yeah,
understood
it's
about
just the
PCOS?
knowledge. Let
Just
me tell
one
you
thing.
something. Life is very simple. You see, life? God made life to be simple. But most times we make simple things complex and we go seeking for complex things to be simple. God has already given every woman everything she needs to become a mother. You're coming into this world with all your paraphernalia that will make you a mother. But just like the Bible mentioned, in the world, you're going to meet challenges, you're going to meet tribulations, but I have given you the power to overcome them. And the same Bible told us that people perish for lack of knowledge. So when you don't know, like you're an engineer, right? Correct? You're an
Knowledge.
engineer. So pretty much, I'm a novice in engineering. So if I have anything
Yes.
that needs engineering consultation, you're the specialist. But the problem is, there are so many people that don't have medical knowledge, that are not doctors, and they quickly go for personal treatment using herbs. So I will want you to go the right way before you start taking all those drugs by yourself or all those herbs, because because people are really desperate to have babies, so anybody can easily tell you anything, and you can quickly go and try it by yourself. Don't do that. Now, if they have given you a diagnosis of polycystic ovarian syndrome, always seek second opinion. Second opinion is always very important. It's possible that the doctor that gave you that diagnosis didn't actually follow the criteria, so they will just tell you to be taking the drugs you don't need. So look for a very good doctor. Like in my community, I pretty much teach every day for free since 2025, since 2015. So look for a doctor that is well grounded, an experienced doctor, a caring doctor, a talented doctor, a doctor that is very compassionate, a doctor that is vested in helping people. Knowledge alone, like by the time you go through this particular presentation today and you understand the technicalities, the symptomatology, the presentation, the pathways of developing polycystic ovarian syndrome, then when you see your doctor, you can ask questions. You can ask simple questions. Doc, what is polycystic ovarian syndrome? Oh, doc, I have this. Oh, doc, I have that. Then those simple things that are regular by yourself, when you notice the abnormal, then you can begin to worry. For example, every woman is supposed to know her cycle. The regular cycle in a woman is from day 21 to day 35. So, assuming you know
Yeah.
that every 28 days you bleed, then suddenly you're bleeding at day 25
Yeah.
or day 45 or day 60. Of course, it's abnormal. Assuming you normally don't bleed with pain and it's not heavy, then suddenly you're bleeding with pain and heaviness. Then there's a problem. Assuming you don't necessarily used to have pain, then suddenly you're having pain, all of a sudden, then there's a problem. So that power of gaining knowledge is the difference maker in everything you do. Okay. So knowledge pretty much is knowledge.
Yes.
Just
Yes.
be open to learning
Yes.
things, asking questions. When you don't know and you ask and you decide better. When you decide better, you are better. When you are better, you become better. When you become better, you have what you're asking God for. So, for example, the fact you have polycystic ovarian syndrome should not stop you from having your babies. There are
Yeah.
some people that at the end of the day, if all the treatment modalities I mentioned is not working, then we step up to what we call assisted reproductive technique. So we might likely recommend IUI, intrauterine insemination or artificial insemination, or we
Yes.
might likely recommend IVF, or we might likely recommend surrogacy. So the point I'm making is, no matter where you find yourself, no matter what failed in your quest to become a mother or a father, don't yield, don't give up. Always step up, always get up, keep trying. So long as you're breathing, so long as you're waking up every day and you're trying, you will defeat polycystic ovarian syndrome. So I thank God that with modern technologies, majority of women that have polycystic ovarian syndrome will still go ahead and become pregnant and also have their babies. And we have to also understand that women that have polycystic ovarian syndrome are also prone to miscarriages because of all those hormonal problems and the insulin insensitivity. So majority of them might become pregnant, but because of poor treatment and poor diagnosis, they can have increased possibility of having miscarriages.
Yeah. All right. Thank you so much,
Yeah, I
Doc.
can hear you.
Thank you. Can you hear me now? All right. Thank you so much, Dr. Chudi. We really appreciate you. Thank you for sharing your expertise and compassion with us today. I have learned a lot. I didn't have to deal with PCOS when I was trying. It was more or less like blocked fallopian tube and all that, which was cleared with diagnostic and a lot of treatment. So thank you so much. And our listeners, I'm sure a lot of them will want to contact you, afterwards, and we would like to know how can we
Okay, so
reach
pretty
you
much what I'm
after
gonna
this
do,
program.
yeah, pretty much
You
what I'm gonna do. I'm
know,
sure you have your
that's what
community,
where how
right?
can we
Beyond
perfect.
this,
Yeah.
you have your handles in all your various social media
Yes, I do.
outlets, right? So SGHS is pretty much in all the social media handles. So we
Yes.
have 3 groups.
Yeah.
We have 3 pages in Facebook. So where the platform where I used to teach pretty much every day. We're in Instagram, we're in TikTok, we are in YouTube. So pretty much where everybody go to, have ever, you can find us there. So what I'm gonna do after this, I'm gonna send you the
Really
link
well.
and you can share with your community. And we also have provisions for people that are currently resident in Nigeria to
Okay.
get a consultation package. So for example,
Definitely.
if you want to talk to me, you can come in for 1 week, you can come in for 1 month, 3 months,
Oh,
6 months. If you're already pregnant, you can also get a consultation package of A and C, because it's not just all about becoming pregnant, it's about becoming pregnant and having your babies. So our group is not all about helping women to become pregnant. We want to help you to become pregnant and go through your first
well,
trimester, second trimester, third trimester, and have your baby in your hands. So if you need help, especially the best time to seek help is in January. When you're setting your SMART goals, when you're making your New Year resolutions, use your January as a template. How you start your January will determine how your December is going to end. So if you're currently believing God for babies and it's not forthcoming, so the definition of infertility is the inability to become pregnant after a period of 1 year. If you're making love with your partner and you don't have pregnancy positive outcome, then you have infertility. Now, that infertility can be primary infertility if you have never been pregnant in your life, or secondary infertility if you were pregnant before, but right now you're struggling. So, once you feel within you that time is no longer on your side, don't waste time. So, you cannot allow 2025 pass you by. You have only 9 months to become pregnant and have your baby. So if you do everything right from September, you're going to gain the knowledge you need. You're going to be referred to a fertility specialist, and you're going to do what you need to do so you can be called a mother, which is the original design of God for you. So seek help. You can get help. I'm open to help everybody. Anybody that needs help can find help. And the help I give is pretty much very affordable. And I show up every day and I provide free services to people out there. So once you hook up to my channel, you
right.
can always find what you're looking for. And by the special grace of God, you become a mother, even with polycystic ovarian syndrome.
Thank you, sir. Thank you. Thank you. Thank you. Thank you, Doc. We are so, so grateful to have you here with us today. And we have learned a lot. You have shared a lot with us. And I'm very sure a lot of us will be reaching out to you after this program. So thank you once again. All right. I'm sure today has been a great day and we've all learned a lot. To everyone listening, remember you are not alone. And as Doc said, there is support, there are options, and there is hope. So start well. So thank you for tuning into this episode of Fertility Diaries. In this conversation, if you really want to share with us, you want to share anything with us, you want to share your story, you struggled with infertility before and you become a mother, and you want people to hear your journey and get blessed by it, you can reach out to us. And if you would like to be, part of this assignment, just share. You can send me an email on infertilitydiaries87@gmail.com. We would love to hear from you. Until next time, stay hopeful, stay strong, and remember, you are never alone on this journey. All right. So thank you, everyone. Let's have a great day. This has been episode 9.
Yeah,
I'm
bye-bye,
your
guys.
host, Nkechi.
Bye.
Thank you and bye bye. Thank you, everyone. Bye.